Within this regard, we would like to acknowledge on what's the program and challenge in achieving Goal 6 of SDG. What are the key interventions being implemented to support children and youth amid the COVID-19 pandemic? What are the proposed short-term interventions and long-term strategy for support clean water, sanitation, and hygiene for post-COVID-19 recovery? What role should multi-stakeholder and publics play to support the process? Excellency, honorable guests, ladies and gentlemen, within this meantime, we are honored to have our permanent leader and researcher in the diverse development field who will deliver their valuable comment and insight in the program today. And before starting our program, please allow me to introduce our honorable speaker who are waiting on the screen to share their presentation and comment. First of all, please give a warm welcome to our honorable speaker, His Excellency Jiripong. His Excellency Jiripong is a Director General Technical Affairs of Ministry of Rural Development. He worked at the ministry for almost 20 years. Prior to assuming his current position, he was the Deputy Director and Director of the Department of Rural Healthcare for 8 and 5 years, respectively. His Excellency Jiripong holds a master's degree in public administration from the University of Cambodia in Australia and Rural Development Management from Gonggang University in Thailand. Second, please allow me to introduce our honorable speaker, Mr. Pirongkul. Mr. Pirongkul is a water supply sanitation specialist at the World Bank of Cambodia. Over the past 30 years at the bank, he has led a number of technical assistance on water supply and sanitation, focusing on the sector strategy, action plan, institutional capacity building, regulation, monitoring, and evaluating decentralization and private sector engagement. Mr. Pirong holds a master's degree in infrastructure planning from Toyohashi University of Technology in Japan. Last but not least, please give a big applause to our honorable speaker, Mr. Lim Minh. Mr. Lim Minh is an executive director of Cambodia Water Supply Association. Previously, he worked at the AIDS Action as a program coordinator, coordinating and managing the subcommittee and partner. He also worked for GIZ Regional Fit for School as an advisor and worked for Save the Children in Australia as a program coordinator. He holds a master's degree in rural development and project management from Bill Bright University, a high school teaching diploma on mathematics from the National Institute of Education, and a bachelor degree in mathematics from the Royal University of Cambodia. Excellency, honorable speaker, distinguished guests, ladies and gentlemen, to follow our agenda today, we will be started our captivating program with the first agenda on CWA work to contribute to achieve SDG 6, which will convey the speak by Mr. Lim Minh. And the second is on World Bank support for rural water supply and sanitation improvement in Cambodia. The speak will be delivered by Mr. Pirongkul. The third agenda will be on the progress, challenge, and plan for rural water supply and sanitation service in Cambodia, which will be giving the speech by His Excellency Drepung. As for our last agenda, we will open for the floor discussion, and then we will have a group photo section with all our honorable speakers at the end of the program. Excellency, distinguished guests, ladies and gentlemen, if you wish to have any question during the presentation period, please drop your question in the Zoom chat box or Facebook Live, so our team will collect all the questions for our speaker. Without further ado, please allow me to invite our honorable speaker from Cambodia Water Supply Association, Mr. Lim Minh, to deliver his speech on the topic of CWA work to contribute to achieve SDG 6. Mr. Lim Minh, please, the floor is yours.
Thank you, moderator. Good afternoon, Excellency, ladies and gentlemen. I'm Lim Minh from CWA. I'm as an Executive Director for Cambodian Water Supply Association. Today, I'm very honored to be a part of AVI-SDGs Dialogue on Clean Water, Sanitation, and Rural Development. First of all, I would like to thank Asia Vision Institution for organizing this important event. And I would like to acknowledge to Mr. Kopidom. He's from World Bank, and also His Excellency Drepung from Rural Development. Yeah, I'm happy to say about that CWA has been doing so far to contribute to the SDG 6. And my content today, I will present about CWA and about SDG 6 and relevant ministry on water supply. And about the third is about the water supply operator. And the fourth is about CWA work to contribute to achieve the SDG 6. And the last one is about the challenge of the water supply in Cambodia. So I request for present share my screen. I cannot share my screen. Okay. Did you see my screen?
Yes.
Okay. So this is my content as what that I have told earlier about the content today that I will share. And the first one I want to share about the CWA. CWA is one of the associations that we established in December 2011 and official register at the Ministry of Interior in 2012 as an independent and non-profit and non-political organization. And for our vision, we want to see Cambodian everywhere can access to clean and safe water in accordance to the Cambodian water quality standard. And we have three missions to reach our association vision. One is to support and promote a mature cooperation among water operators in Cambodia. And the second is to enhance knowledge and technical skill based upon leading practice in Cambodia. And the last one is to encourage and the sustainability expansion of the water supplies in Cambodia. For CWA, we have the structure that the first one is we call assembly, that is a top decision making, and then after that is come to the board of director, and then we have executive committee team. And this is the over third term of the board of director, that we have 9 board of directors member, and all of them is come from the private water operator. And this is our member so far from, we come from the first start in 2012 to 2021. And you can see in the graph that our member is increasing from year to year. And right now we have 286 members that among of them we have 255 is come from private water operator, and 31 is from the company who are supplied to the water sector. And this is for CWO role. For overall, we work with the Ministry of Industrial Science and Technology and Innovation. And also, we also work with the development partner. And other side, we work with the supplier and finance institution to make sure that all of these contribute to help our operators and all of the relevant partner. We try, and also with CW and our member private water operator, we want to see people have to access clean, safe, and affordable water. And this one is about the Royal Cambodian government targeted for related to the water supply in SDG6. And we have two. One is about by 2025, 100% of urban population access to safe, affordable, and sustainable water supply. And the secondly is about by 2030, to achieve universal and equitable access to safe and affordable drinking water for all. In the private water sector right now, what we on zero experience, we think that we have the 6 ministry that is relevant to the water supply sector. One is about the Ministry of Industrial Science and Technology and Innovation Policy. That it is one of the, we can say that like parent ministry to a license for the private water operator and play a role as the regulator. They produce the regulation to private water operator, they monitor and support to private water operator as well. And secondly is about the Ministry of Rural Development. It is one of the ministry that also, I think also they also have like kind of community rural water supply something, yeah. And the third is about the Ministry of Public Work and Transportation. This is related to relevant to our member private water operator on the pipeline, pilot under the ground, that it is related the issue, and we have many challenges on that part as well. And the fourth is about the Ministry of Water Resource Management and methodology, that it is the one that regarding to the water source, related to how to manage, how to request regarding to the water source or the expansion, the pound, etc. And the fifth is about the Ministry of Environment, that is one regarding to the quality of water source. And the last one is about the Ministry of Agriculture, Forestry, and Fishery. That this one is related to using the water to for this ministry more focus on the water that is used for the agriculture. And so this is that we need to make clear on the prioritize of using the water source. For the Ministry of Industry, Ministry of Ministry, we normally, the ministry, they have the 4 requirements for water supply in Cambodia. The water must be to have a quality and have the water supply have to meet the safety, mean that people can drink and use without harm or without affect to the people's health. And the third is about water supply have to meet the sustainability. They have to produce 24 hours per day or 7 days per 24 hours per day and 7 days per week. And also the water pressure is meet to the standard like 0.5 bar at the end of the pipe. And also the last one is about the affordability, mean that people can afford to the price. For our water supply in Cambodia right now, based on the report from the Ministry of, based on the Ministry report by 31st of July, we can say that The total of private water operator is about 424, and among of them is 304 PWO, 304 PWO licensed by MISTI, and 110 already submitted their visibility study to the MISTI, and among of them 40 already evaluated, and other 10 is in the process of feasibility study. And among of them, I can say that 255 people are our members. And also we have public utility 10 and plus 2 Phnom Penh and Siem Reap Water Supply Association Authority. And also the result that are produced by the MISTI by annual report 2020, the total of connection is about close to 1 million. And among of them, you can see that from the 10 public utility, they have like 85,397 connection, and from the private sector, 256 private water operator, they supply to 470,114 connection. And Phnom Penh water, we can see that it is about 408,115, and for Siem Reap is about 12,995. That we can calculate approximately, we can say that close to 5 million people in the country that can access to the pipe water. And also I can say, I can see also in the report of MODI 2019, 2019 and 2020, it is about 80% of population access to improving water. That among of them is 88% in urban, and rural is about 74.7%. And I can say that for overall, it's about 30% of population access to pipe water. And about the serial work to contribute to achieve the SDGs, we have two main activities. One is about the core, we call core activity, and the second is about the program activity. For the core activity, we have work for represent our member, like a kind of advocacy or networking. And also we play a role of to provide a capacity building to our member on technical and business management. And also we try to work to retain our member through member visit, regional meeting, and member retreat, etc. And also we work to promote accountability of our member water supply services. And also we conduct the annual General Assembly for make a good relationship among our member, as well as we present about the achievement for the CWA done for 1 year, and also we present about the next year planning. And also we conduct a co-organizing water conference every 2 years. Actually for this year that it is the fourth water conference that it will be conducted in October this year, but according to the pandemic of COVID-19, we decide to propose to postpone to the next year for our conference. And also we work to promote professional work through the website, Facebook, or a newsletter, and annual report on networking. And also we build a partnership with the Ministry, Development Partner, Association, and also private sector. For current program that we still have right now, we have 4 projects. First one is about the washing project. It's one project that we work to access to the finance. In this project, we try to help our member, especially to the private water operator. On the first one is about doing the business plan. We conduct the technical assessment to let the PWO understand about what is the current situation of their water supply. And also we work with the banking to make sure that the bank or MFI, they understand well on water sector, and they will consider to provide loan for the private water operator. And also in the WASIN project, also we work for public engagement by we conduct a subnational meeting between at the provincial level, district level, and community level. Moreover, we also conduct a kind of water tour to local authority to understand about what is the water supply, how can the water treatment work, or something that is one way that let the local authority, especially in commune and village level, to understand well about the water supply and the importance of using the water supply. And they also, it can be one of the agency to advertise or to explain to their community people. And also we work with the UNICEF project on a climate resilient on high water supply in climate change risk in Kampong Speu and Takeo province. This is we support on pipe connection and also village pipe water supply in village level for and the last one is about improving the water source. And for project with the East Midwest, we work with our operator to provide proposed subsidy connection to the poor one and poor two villages. And the last one is about a water aid project. It's one project we call strengthening service provider accountability for improving the water supply. This project we aim to make it more increasing on the water supply service in order to let the user get more and more trust and happy with the water supply service that provided by our members. And about the strengthening the partner, we have MOU with the Australian Water Association, and also we have MOU with the General Department of Potable Water Supply of the Ministry in Industrial Science and Technology and Innovation, and also we have MOU with Koba in Japan. And right now, I can say that for Silver member achievement, right now for Silver itself, we have 281 member that are 255 is a private water operator. And among our members, we operate in 20 provinces. And we in the 23 provinces, we have 128 districts. With 564 commune and about 4,965 village, and approximately I can say that it is about 400,000 connection that our member connected to the household. And the last one is about the challenge of water supply in Cambodia. I will say about the three of the challenges. The first one is about the water sector challenge. The first one is no water supply law. Water supply law right now it is in draft. So this is one of the challenge. And the second is about the limit of water professional. It means that I have not too much for people who have a skill in water sector. And also PWO management skill is limited, and the limit of water investment. And also water pollution activity are increasing from day to day. And we can say that as what that I have talked before, that it is about 30% that I can say it is low number. And water service quality is still lower than the standard, and also a lack of coordination in water sectors. And the remaining area mean that a non-licensed area and not potential to attract the investor. For the private challenge, the first one is about the pipe damage that is come from pipe damage, as you can see in the picture that it affected by the development work. Some is from road construction, or people they do like some of the agriculture activity. And PWO cannot lay down the pipe network by the sub-degree, mean that as you can see that over people, when they are building their houses, they not follow to the law. So, you know, some of the houses is still difficult for our private water operator to lay down the pipe through the sub-degree. And about a lack of investment for pipe network expansion, that water service quality improvement. This is also come up the challenge for our operator. And private water operator cannot respond to the loan requirement from MFI and bank. As you know that the bank, they require about the collateral. But for our private operator, they come up with the business about family business, so they not have enough investment about the capital, so they have to loan from the bank, and all their collateral already in the bank, and if they want to add their loan, they don't have the other collateral to put in the bank for get other new loan. And the fifth is about the limit knowledge on technical and business management. And the thing is about low awareness on water supply in community. This is still, we can say that, especially we can see this one is in the location who have the multi water source, especially the people who live close to the river. So the people, they don't want to connect to the pipe water, or sometimes they use the pipe water very less, and because they use the other source of the water from the river or from the pond, something like that. And limit of water supply service quality and affected from COVID-19. Recently we do the research, we can see that most of our members is affected from COVID, as they lost their income and increase the expenses, as some of people, they don't have enough money for paying to the water tariff and to the bill, and some of them will require for delay, and this is made their lost income. And also for some location that is a high risk of the COVID, the private water operator cannot expand their pipe if they have ability, but they still cannot do it. And some of the NGO, the last one, some of NGO working on to support household to dig the well or pump in the licensed area, that it is very difficult to deal with, because this one as CWA, we plan to have a meeting in the WAS working group to discuss about this, because it is not a good a sign for NGO who are working to support the household to dig the well or pump in the licensed area, that it is made like a kind of contraction. It's contrast each other with the pipe water supply. Also, CWO itself, also we have a challenge, as we can say that CWO, we have many roles and responsibility, but the budget is still limited, and people hesitate to pay for a training fee, and CWO, we have many roles but no authority. And CWA can build people capacity, but PWO has not willing to improve their water service quality. And a member fee cannot afford to the operation costs. Yeah, I think that's all from my presentation today. Thank you for your attention.
Thank you so much, Mr. Lim Ming, for your nice presentation. And briefly describe about CWA vision toward SDG Goal 6 and some key talent of water supply in Cambodia. And to follow up with our second agenda, I would like to invite our honorable speaker from World Bank, Mr. Pirong Kert, on the topic of World Bank support for rural water supply and sanitation development in Cambodia. Mr. Pirong, please, the floor is yours.
Yeah, thank you, Kim Liang, for facilitating the sessions, and also thank you, the AVI, for organizing this very important and timely sessions on the water supply and sanitation and the SDG. And also welcome all the colleagues. My name is Pirom Kov. I'm the water supply and sanitation specialist based in the World Bank. So let me try to share the screen. Let me see if I can do it. Okay. Can you see it?
Yes, please.
Okay, perfect. Okay, so Ming has from the CWA has already provided a very detailed overview or detailed challenges that the water sector is facing, at the operator level or the operational level. That's where he's working with his members of the CWA to work around these issues. But let me try to bring you back a little bit into the bigger picture, right? In terms of where we are on the progress and challenges toward the SDG for water supply and sanitation in the Cambodia context. So first of all, I'm sure many of you have already been aware of what SDG mean, and water supply and sanitation is of course in the SDG 6 out of all the SDG, and this is the first time, right, compared to the MDG where water supply and sanitation was not explicitly mentioned as a goal. It was embedded in other goal, environmental sustainability goal, but this time on the SDG it looked like the whole world agreed that water supply and sanitation is very important. That's deserved to be a separate goal in itself. And that's really a big momentum for all of us to kind of look into this issue together, right? And then, there are so many targets and indicators in that goals for water and sanitation, but I just want to highlight on the one that are related to WASH, right? Because, under the SDG, the target was that by 2030, every country is supposed to achieve the universal and equitable access to water supply, to safe and affordable drinking water. And they will be measured by the proportion of population using safely managed drinking water, right? So the term that I'm highlighting here with the underline is the safely managed drinking water, which I will explain later why this is important in the SDG context, and why we need to keep in mind that, this is something not easy, and this is something we need concerted effort from all the stakeholders to work together to help the country achieving this universal access, right? And for sanitation, very similar. By 2030s, that's where the whole world is committed to achieve adequate and equitable sanitation and hygiene for all, and more importantly, to end open defecation, right? I'm sure you know what the term open defecation means. It means people have no toilet, they just go to the bush, they go everywhere, to do their toilet stuff. And the way the SDG is measuring is by checking or by monitoring the number of or the proportion of population using safely managed sanitation services and hand washing facilities. Right, so these are the key definitions that I want to highlight, and why it is important for us to understand in the context of the SDG. So just to keep in mind, from the MDG to the SDG, the level of service that is required is getting higher. Why it is that? Because in the Millennium Development Goal, the MDG, where it was set, I think back in 2000, in the year 2000, at that time, the country is committed to have, when it comes to water supply, we are only talking about basic improved water supply. And what we mean by improved basic water supply, it means the water source, which by nature of its design or construction, it has the potential to deliver safe water, right? Here we have the term potential. It doesn't mean that all the improved water sources are safe to drink, at the point of source, but it has some sort of protection at least, because like, for example, the tube well with a platform, with a concrete platform around it is called improved water, regardless of how far they are from your house, or a duck well, dong chit in Khmer, but as long as you have a cover and you have the platform around it, This is called improved water. It's very kind of like a very basic, right? Because at that time, remember, it was year 2000, which is quite early. And that's where I mean, we are setting that goal. And then come to SDG. This is where, you know, everyone is committed to a higher level of service, because we don't want people to get just improved water source, but the improved water source that is with the other three conditions, which is accessible on premises, meaning that you can access at your house or at your plot. It is available when needed. So when you turn on the tap or when you need it, the water is there so that you don't need to wait for too long. And it's free from contamination, right? So those are the additional definition that the SDG add on to kind of bring the level of service for water supply to become higher, right? So this is something that for practitioners and for policymakers, the government, development partners, NGO, this is something that we need to see how we can incorporate that in the policy and in the strategic plan to ensure that what we are committed in the UN, you know, assembly, you know, for the SDG 6, we need to achieve that as well. For sanitation, it's very similar story. You know, in the MDG, we are talking about just a simple facilities that can separate feces from human contact. That is good enough, right? By bringing people from open defecation to a fixed place defecation, that is good enough at that time. But it's no more. You know, in the SDG, we need more than that. We need an improved sanitation plus, right? Improved sanitation, which means the sanitation that meet all the previous MDG definition. And it should not be shared by others, meaning that if you have one toilet shared by several households, this is not considered a safely managed sanitation. Of course, you have a nice toilet, whatever, but the fact that you are sharing with the other household, you know, this is not meeting the safely managed sanitation. But what is more important to keep in mind and to reflect on is that the feces that are contained or that are captured in the toilet, it has to be either treated in the place, you know, like if you have a septic tank that is properly designed and so on and so forth, that can be considered as safely managed, or it can be stored, you know, for some times, and then someone else come and pick it up, like a vacuum truck come and empty your pits and so on and treat it somewhere in a proper place. Those are also okay. Or you have connected to a sewer, but it's not enough. A sewer and a sewer with a treatment plant. Imagine how many treatment plant, wastewater treatment plant we have in Cambodia. You can already get a sense of what it means for improved sanitation. You know, the evolvement from the improved sanitation to the safely managed sanitation means in terms of the service and in terms of the infrastructure investment that are needed, right? So this just to give you a flavor of the evolvement of the definition, you know, from the MDG to the SDG, so that you get a sense of what is really different from the MDG era and the SDG era. So now let's come to see Cambodia. Are we on track? So I'm looking at, of course, there are so many data for water supply and sanitations, and I'm taking the UN, you know, joint monitoring programs that is developed by UNICEF and WHO, just try to see where we are on water supply and sanitations. And we can see, you know, right now by 2020, for kind of like improved water, we are around somewhere around 70%. Of course, the government data says around 80%, but, you know, with this margin, as I said, depending on which data you quote, which data you use, let's use one data and try to project. So I'm using the GMP data, and we see that right now we are having the access to water supply around 70%. And whether we can meet the 2030 target, no. With business as usual, we are not able to go there because we need to accelerate, we need to bend the curve. So I put the regression line here, as you see the dot there. We need to bend the line to actually make it going up faster, meaning that the annual increase of investment or the annual increase of access has to be accelerated in a way that can meet the 100% coverage by 2030. And it's even, you know, more desperate when you look at the safely managed water, the green line under the water supply chart. you know, with the SDG definitions, the access to safely managed water is getting much lower, right? Because by 2020, we have less than 30% of the population that are having access to safely managed water. And by 2030, if we keep the same progress, business as usual with linear trend line, we are somewhere around 30 plus, right? And remember, Cambodia want to get to become the upper middle income country by 2030. So we cannot afford to have that low level of basic water supply service. But by the time that we are achieving the upper middle income country status by 2030. And for sanitation, similar story. We don't have the data for safely managed sanitation. So, you know, of course, if you look at the trend, the sanitation did a good job nationally. We can achieve based on what the trend line tell us. If we keep the same trend, but of course, keep in mind, you know, reaching the last mile from now to 2030, meaning that we are having the most difficult to reach areas, or you need to reach the marginalized group or the poorest of the populations. And that's where more in concerted effort and investment need to put in place to reach those populations. So the trend line may not be as linear as you expected. It may going down, you know, if the level of effort remain the same. But to maintain the linear trend, you need more investment and more concerted effort. But the good news is, the openification has been dropped significantly over the last 2 decades, you know, from somewhere near 90% to somewhere 20%. And it looked like by 2025, we can end openification. And that's where the government has set a goal for rural water supply and sanitation to have universal access to sanitation by 2025, you know, including ending openifications and so on. So this is just to give you a sense of where we are in the big pictures view about where we are when it comes to the openifications or when it comes to the SDGs and the water and sanitation. But remember, you know, regardless of the overall good progress on water and sanitation, one thing that we need to also remember is the disparity, right? The rich, the poor, and the urban, rural. Those are the things that we need to keep in mind, especially for sanitation. As you can see in the chart here, the richest segment of the population, the chance of them having access to sanitation is 6 times higher than the poorest populations. And for water, they are not that bad, you know, around 1.6 times difference between the rich and the poor. And what it tells us is that for sanitation, as you remember in the last slide that I mentioned, you know, to reach that other segment, you know, from the current status of where we are to the 2030 target, we need to actually address the poorest the issues that are pertaining to the poorest populations to do that, right? To kind of achieve that universal access. And then when it comes to the financing gap for water and sanitation, you know, we did the estimate in 2015. The financing gap is huge, right? For water supply and sanitation to meet its universal target. Where for water supply, we need somewhere around $92 million per year, right, of investment to reach a target. Of course, you know, at that time, the anticipated investment and so on, we still need another $60 million per year, right? That's what I'm talking, to reach that investment. And then for sanitation, we need somewhere around 120 million. And then I try to check where those investment is supposed to go. Actually, it's supposed to go to the treatment plant and so on and so forth, that the heavy infrastructure that are required, especially when we are talking about meeting the SDG of, you know, treating the wastewater and so on and so forth. So now, you know, those are the challenges and those are some of the big pictures that I want to share with you. But now come to kind of how to access or how to accelerate the access to water and sanitation. Just 3 things that I can think of right now, or I want to highlight at a very high level suggestion, right? Number 1 is to address the disparity, especially the inequalities that are existing right now between the poor and the non-poor, because you can see the access between the poor and the non-poor are very significant in terms of the difference. And secondly, we need to mobilize financing in a very innovative way for WASH, of course, beyond public sector, because there's no way that the public sector can finance the water supply and sanitation to meet the SDG that we want. And the third part, last but not least, is to improve the service delivery pathway, because we need to look into the policy, the planning, the budgeting, the expenditures, the sustainabilities, the outcome, the use, the maintenance, all of those are called the service delivery pathway, that we need to see where the bottlenecks are and how we can do it to improve the situation, right? So disparity, financings, and the pathway that need to be addressed. So just a little bit on the World Bank project. We currently have a $55 million World Bank project that is ongoing up to 2024. Considering, keep in mind what I mentioned before and connect to what we are trying to do here. We have in the project, we put some part of the loan of the financing to help building the infrastructure like the water supply systems in towns and in districts across Cambodia. Of course, not everywhere, but in some selected areas that the government asked us to go. And also supporting the government in improving the sewerage network in Siem Reap cities. That's what we are doing right now on the infrastructure side. But then on the non-infrastructure side, which is also quite important, and for the World Bank, we really emphasize this as one of the core support that we have to do with the government, is we are supporting as part of the project to update the WASH policy, because we have a policy that was enacted in 2003, so it's time to update it and review and update it to make it more consistent with the current context. We also look at the tariff framework for sanitation, wastewater, making sure that they have the cost recovery over there, because you may know the sanitation, the wastewater fee is not really clear in the current framework in the country. And the third point is the behavior change communication for WASH, because we know by just providing water to people may not be enough. You can see the picture of Ming's in presentation that people have clean water, they put in the jar, and then they recontaminate it before they use it, right? So it's important to have the BCC also making sure people use water properly for wash their hands, especially in the COVID-19 time where wash hand is getting more important, and the hygiene part, drinking the clean water, without recontaminating the water that has been properly treated. And also under the project, we are supporting the ministries, the government, to support the poor connection to poor household, and also bring in the private sector partnership in the water supply, because we know that it's important to kind of champion or to leverage the model to engage the private sector to come along with the public sector. And also, we bring some sort of innovation around urban sanitation, because so far when people talk about urban sanitation, they are talking just about sewerage, but there's no way that any country can reach universal sewerage in urban areas. So we bring in also the non-sewer solutions in the sanitation systems, like fecal sludge management. All of those are very technical terms, but we look into the whole value chain of sanitations to be addressed as part of the project. And last but not least, to support the government on working with the household, with communities in Siem Reap cities, especially to connect to sewer, so that they are not polluting the rivers and the stream across the cities. So with that, let me stop here, and I would like to thank for your attention.
Thank you so much, Mr. Pirung, for your insightful presentation, and that would be our good start for our discussion section later. And for the next, I would like to turn the floor to our honorable speaker from Ministry of Rural Development, His Excellency Tripom, to deliver his speech on progress, challenge, and plan for rural water supply sanitation service in Cambodia. His Excellency, please, the floor is yours.
Thank you very much, moderator. Good afternoon to all speakers, Mr. Koh Pirom, Mr. Lim Ming, and all the reviewer, all the viewers around the world. With the permission of Excellency Minister Okrabun, it is my great pleasure to join this webinar on clean water sanitation, rural development, and rural development. I don't have a slide for this, but let me talk as a storytelling, because the previous speaker has nicely presented already about the sector as a whole. So let me talk as a storytelling in terms of what are the history, what are the progress, and then what are the way forward for rural water supply sanitation and sanitation. So I will outline my talk as following. I will start my talk briefly. What are the progress, what are the achievements that we have made in terms of rural water supply and sanitation. And then I will talk also briefly, in addition to the previous speaker, on the challenges that we have faced and also a way forward. So let me start with the progress or the achievement that we have made. Actually, with the leadership of Samdech Techo, Prime Minister, that we have peace and stability, Cambodia has made a substantial progress for all sectors actually. And for rural development as a whole, we can see the big change as well. More specifically, in terms of rural water supply and sanitation, with the strong political will and a clear vision, as it has been mentioned by the previous speakers already, about the policy, about the vision that we have set, and the right strategy and the clear action plan, and the support of all relevant stakeholders, both has been improved noticeably. We can see a big change actually in terms of rural water supply. We can see the big change from just around 40% and in 2008 to around 75% for now, as it has mentioned by Mr. Ming already, the current coverage for the rural water supply. Sanitation has a big jump actually, from just around 18% in 2008 to around 75% for now as well. I'm talking about rural area. So just a quick reflection to the presentation that have made by Pirom, because we had an opportunity to work together for a long time, because Pirom was involved with the sector for a long time as myself too. In fact, I have involved with the Ministry of Rural Development for more than 20 years actually. So in WASH, more than 10 years, we can see the story behind that. When we started to prepare ourselves, the so-called MDG, during that time, we're trying to set the target of 50% of rural water supply and 30% of rural sanitation. And we still recall the discussion that we have made. When we set that target, we all feel that, oh, we set the high bar and we're trying to achieve that. Even we could not make it, but set the high bar. But fortunately, we managed to reach even to pass the target. Because in 2015, the MDG target, we managed to reach 52% for rural sanitation, which is above the target of 30%. And water supply, we managed to reach 63% out of 50% that we have set. So this is a great achievement that we have made, I think. And again, when we set the target, we feel that it is far away, it's very high, but we managed to achieve that. So my comment here is let's make a high target and then try to achieve that. And then again, in terms of the NSDP, National Development Strategic Plan, we also set the target of 60%, but we also managed to reach above the target again for sanitation. We reached 71% by 2018, but the water supply, we somehow almost reached the target because we able to reach 58% by 2018. So again, we made quite a good progress so far until 2018. And this achievement has been recognized globally, actually, because I still recall the discussion that we have made in the past in several meetings and several workshops. There are always a projection that Cambodia would not be able to achieve the MDG target, or even close to the target, but we managed to somehow to pass the target that we have set. So with the open defecation reduction, as Pirum has mentioned in the graph also, we have a very good progress on that. Cambodia has been ranked as #2 country in the world in terms of reduction of open defecation practice from 2000 to 2015. So it's a big achievement actually on that. And in the international platform, actually, Excellency Okrabun, Minister of Rural Development, has been elected as the steering committee of Water and Sanitation for All, representing the Asia and the Pacific regions. So this is a very good platform actually to share, to learn, and then to try to formulate a multi-stakeholder platform to move forward. So again, this story is just to reflecting that we need to be optimistic. I think even we set the high bar, but we try to do whatever we can so that if we cannot achieve that, or we can get close to that target. And I think several factors which contributing to those success. The strong political will. I think the turning point was in 2007 when our Prime Minister have joined the so-called National Sanitation Forum, which it raised the profile of the sector, and then there's a turning point on that from that time onward until now. And fortunately, we have the clear policy. Again, I'm still impressed with the policies, especially the so-called sector vision, because as we all know, that the policy has been formulated long time ago. For the urban water supply and sanitation, the policy has been formulated in 2000, actually, a long time ago, but they still set the vision of universal access by 2025, which is amazing, because even with the low coverage, with the low access, but there's a clear vision of having a universal access by 2025, which is quite well aligned with the so-called SDG right now. And for the rural water supply and sanitation, the policy has been endorsed in 2003, and we set the same target, which trying to have the universal access by 2025. And another factors I think contributing to the success is the right mechanism that we already have for now, and then it has been established after the movement of Excellency of our Prime Minister in the first National Sanitation Forum. We established the structure, the mechanism so-called technical working group, which I think play a very important role to facilitate, to coordinate the stakeholder to work together effectively under the umbrella of this coordination mechanism. And because of that, our minister right now has suggested to formulate the very similar mechanism to all the subnational level as well, especially at the provincial level, district level as well. So again, this platform serves a very important role in terms of mobilizing the support and also trying to improve the efficiency and effectiveness of working together among government agencies, institutions, and also development partners, NGOs and INGO to work together to the common set target and goal. And we also have several other platforms actually to enable us to have an opportunity to share, to discuss, to find the way forward together. For example, we have the WhatsApp group, we have the water quality group, we have the RUSH group, etc. So this is another strength that contributing to this success, I think. And then another one is the contribution, of course, and the participation from all development partners, IOs, and also NGOs, private sector, academia, and also, most importantly, the people themselves. I think they, if you're talking about the gap, actually a huge proportion of the investment is coming from the people themselves, especially the sanitation, because for those who can afford, they invest themselves to build a latrine so that they can have access to sanitation. And some of them also do the same for water supply as well. So this is something I think that we shall address, we shall recall, so that it gives us an optimism to move forward. At the same time, we can see some challenges as well. And I think some challenges has been addressed by our previous speaker already, but maybe some other parts which I think I shall highlight as well. So as Pirum has mentioned, the last mile is not easy. Of course, we have a very big jump recently, especially for the last 5 years or so in terms of access. But at the same time, we can see the gap right now, of access between the rich and the poor, especially for the sanitation. So that is something that we need to address. And also more resources is needed toward reaching the so-called sector vision, as Pirum has mentioned. But again, we need to think more broadly, I think, in terms of resource. We need to try to find a way to mobilize other resources, especially from the people themselves, if they can afford. So we need to have more strategy to mobilize more resource for the sector. And another challenges that we are facing is to address for those who are living in the challenging area, for those who are living in the flood-prone area, floating communities, mountainous area, etc. So we need to find the way to support them, and also we need to support the people who are needed a special support, like for those who are disabled, for those who are elderly, for those who are pregnancies, and so on. So we need to have a special intervention to those groups as well. So the way forward, I think, again, I urge you, we all, to have a more optimistic moving forward, and we hope that with the strong participation, with the strong involvement, and all stakeholders working together, we still be able to achieve the target as we have done in the past. So we have several goals actually ahead of us, several targets actually. Our short-term goal is to reach the target of the National Action Plan, which we aim to reach 90% by 2023. So this is our short-term goal. And with the current trend, I think it is still manageable to be able to reach that one. And at the same time, Excellency Minister also have another target initiative to have another target, which we're trying to have 5 more provinces to become ODF, open defecation free, by 2023. So this is another new indicator that we imposed, and then there's something that we need to focus more on, as Pirum has mentioned, that the open defecation free rate is is in the good shape if we do the projection right now. And another one is the to be able to reach the sector vision that has mentioned in the policy, as I said, when the government has formulated in 2000 and 2003 to make sure that everybody in the rural community has sustained access to safe water supply and sanitation services and live in the hygienic environment by 2025. So that is another target that we have. And then definitely we move forward to the SDG goal 6, as all the previous speakers mentioned already, to ensure, actually it's a goal number 6 actually, to ensure availability and sustainable management of water and sanitation for all. MOD, Ministry of Rural Development, is responsible for 2 targets actually, 6.1 and 6.2, and I think the previous speaker has mentioned already. 6.1 is by 2030, we want to have achieve the universal and equitable access to safe and affordable drinking water for all. And 6.2 also by 2030 to achieve the access to adequate and equitable sanitation, hygiene for all, and open defecation, paying special attention to the need of women and girls and those in the vulnerable situation. So those are the kind of clear targets that we have set for our SDG, and we already set also clear indicators to respond to that target, and definitely Pirum has touched on that area already, which is first of all to make sure that we can reach to the basic access, and then secondly to make sure that we will be able to reach the so-called safely managed both rural water supply and sanitation. So I think this is a kind of story behind, and then the challenges that we are facing, and then the way forward that we need to move forward together. And as I said, I still believe that with the joint effort, with the platform that we have, with the mechanism that we have, with the strategy and national action plan, I think we will be able to move toward that target. Even we cannot achieve that, but we come close to that. So I strongly hope that we can do it as we have done in the past, because I still recall the memory that we have discussed previously, especially with Pirum. We did the similar projection in the last 10 years or so, and then we can see that Cambodia will reach the target of universal access by 2050 or 2100 or something like that. But the story has changed. We somehow managed to have a very good progress so far. So I hope that we can repeat that success in the future as well. So that's part of my story about rural voice. Thanks for your attention. Thank you.
Thank you, Your Excellency, for your insightful and valuable remarks. Excellency, distinguished guests, ladies and gentlemen, we have been listening to our very insightful comment from our honorable speaker. And now our program are approaching to open for the floor discussion. However, as we have a time limit, we will randomly select the several questions to address. So we got one question, which is about what are the key challenges to convince PWO to extend their service to the remote area where they found to be economically less or even no benefit for PWO at all. And I would like to refer this question to Mr. Lim Minh.
Could you repeat your question again?
The question is, what are the key challenges to convince PWO to extend their service to the remote area where they found to be economically less or even no benefit for PWO at all?
Okay, thank you for the question. I think this is a really challenge for PWO to expand their PI network to the low density location for the rural especially. I think the key that we can convince, if we can find like kind of the subsidy to support them, it is the one way to helping them to expand their PI network. And also other way like a kind of what that I experienced so far with the UNICEF project, that they can provide like kind of support to do like community village PI level, that is to contribute like a kind of the substation for the private water operator to connect in their license. This is the way that helpful for the private water operator. Also, kind of the subsidy on the connection, it is one for help to the private water operator. And right now, I think one more that it is a good opportunity for a private water operator is about the SMEs loan that recently I just got the information last few days. Is about the SME loan that is one for helping to the private water operator as they define a private water operator business is the priority business for getting the loan with the low interest. That is a good one. That can help also to a period to encourage them to expand their finance. Yeah, I hope I answered to the question.
Thank you, Mr. Lim.
Thank you.
For the next question is from our Zoom chat box. The question is as the presented by Mr. Pirom, there was a huge financial gap to achieve universal access, which, while the government planned to achieve by 2055. What can you do to bring more money into the sector, especially from the government who responsible for their people? Please, Mr.
Thank you. I guess the question is from my friend Kit Keng, who we know very well. Yes, that's a very good question, Keng. I think the challenge right now is for all of us, right? I mean, meeting the universal access is very costly, and meeting the SDG target is even more costly, right? Because we need to improve the basic service plus the other service that we need to have in mind. And with that, you know, from our side, we think that the public sector alone cannot do the job by themselves. Of course, water supply is a public service, but it doesn't mean it has to be delivered by the public sector alone, right? You can partner with the private sector to do it, right? And in the past, as Ming said, you know, in the past, the private sector has been already very active in engaging, but the problem right now is how can we make it bolder, right, in terms of structuring a better relationship with the private sector, because because the only way to meet the access to meet the universal access, I think, is to mobilize or to find an innovative financing to mobilize the private sector to come in as part of investment as well. And that's where, under the World Bank project, we are trying to work with the government on a PPP for a small-scale project, you know, but it's a demonstrative model for the Ministry of Finance to understand how the public resource, you know, the public financing and the private financing can come together, and what type of contract arrangement that need to be in place to hold the private sector accountable, right? So with that contract arrangement, the private sector who come on board may not say, well, I cannot go to that area because it's too far. No, you are bound by a contract, you have to do it. And the government has already put the resource. They marry you with the people in that community. You have to be with them, right? You have to provide a service. You have to feed them with water. You cannot have any reason. But that's where we need to find, you know, a structured way to bring in a more professional, also private water operators and so on. But just to add to this, you know, like what Ming said, a lot of issues that we are facing right now in the private water operator is the access to finance. And we need to look into, you know, the private sector side and the financier side, right? Because the financier, they look at something that are more productive for them. And they want to work with someone who is more professional, you know, more cooperative and so on and so forth, right? And that's where we need to see how we can improve our water operator to professionalize them and to formalize them in a way that they can get access to finance. I think that's the only way where we can bring in the water supply access. And for sanitation, rural sanitation, as Excellency Pom mentioned, you know, the mobilizing or leveraging the power of the household financing themselves is in most cases, even in India, Clean India Vision. That's what they normally do. A lot of things to do is to behavior change communication, to mobilize the resource of the household level to build their own toilet, and to bring in the sanitation marketing at the other supply side to bring this investment coming in place. I know it's a long answer, but there's no short answer to that question. Thank you.
Thank you so much, Mr. Pidong. So there is a question from our Facebook Live. What is the government intervention for strengthening rural wash system in Cambodia during this pandemics and post-COVID recovery, particularly who live in the remote area? And I would like to refer the question to His Excellency Jaipong.
Thank you very much for the question. Actually, as we all know, COVID has posed a very huge impact on our country. And we are not alone, actually, because everywhere we have this kind of impact, actually. And definitely it is hampering our efforts to the poverty reduction. And for Cambodia, the economic growth could be contracted from an original plan estimate of around 6.5% to around maybe even minus 1 or 2% by 2020. So of course, with this, there's an impact of all sectors, especially on the services and industry, which lead to unemployment and poverty reduction that we're trying to tackle it. So we government, because of this, have to so-called rationalized the budget investment to divert the investment to the response that is needed urgently to respond to this COVID. And we can see this kind of budget allocation is happening everywhere, including our development partners, those who are working in Cambodia as well. So definitely there's an impact on budget. But I think for rural water supply, sanitation and hygiene, somehow it is still a priority for the government. So even it is an opportunity, especially on hygiene, because in fact, water supply, sanitation and hygiene is the key line of defense, especially the hygiene practices when we're talking about hand washing, which is a big measure to mitigate this COVID-19. And therefore, the government somehow has prioritized this, especially focus a lot on the wash in the public facilities, including schools and also the health centers and so on. So we have done that quite substantially. And of course, government also try to introduce several programs. Actually, it's not just WASH itself, but also other programs like Cash for Work program. The government has expanded this program to be able to contribute to the rural development as a whole, and also through supporting the employment opportunity and also poverty alleviation. And we also got the support from our development partners also to implement a huge social protection stimulus to prevent more than 500,000 people from sliding back to the poverty. So these are the big programs that the government have done, and government is also roll out the COVID-19 ID pool cash transfer to support for those who are in need, in the critical need. So that's what we have done so far. And in terms of WASH-related activity, we have done a lot actually in terms of the awareness raising, and then also provide the facilities, WASH facility to the community areas so that they can have a better prevention to this COVID-19. Yeah, it's more or less we have done, and we will keep working closely with our partners to do more intervention so that we can provide more kind of prevention measures to those who are living in the rural areas, to join with the government, of course, to try to prevent a further kind of expansion or further risk of this COVID-19 transmission to the community. Thank you.
Thank you so much for your insightful comment. We have other question from Facebook, which is about separating sewerage system is really important for sanitation. Will it be applied in Cambodia? Mr. Pedro, would you have any comment on this question?
Well, thank you for the questions. And through my interaction with the government who are in charge of urban sanitation, it looked like the direction of the country moving forward. They try where they can the separate systems, and that's where under the World Bank project we are trying, starting from Siem Reap cities, where the wastewater, I mean the black water coming from the household, is separate from the drainage that are collected, from rainwater catchment and so on. So I would say, I cannot say on behalf of the government, but my interaction with them, I can understand that this is the direction that the government is going through. Of course, it's not to be rolled out everywhere immediately, but wherever they can, they will try to design in a way that the separate system is in place, for wastewater. And just so you know, in Siem Reap, it's a combined system, right? And there's no way to go around it because you have to stay with it. There's a lot of infrastructure that's already in place. But maybe in some new areas, like where there is no drainage, nothing at all, maybe that's where you can start from scratch from there.
Thank you so much for your comment. And I think that's all for the question. And thank you so much, Excellency and distinguished speaker, for your valuable comment. As the time limit, I would like to end our discussion here. And before closing our program, may I invite all honorable speaker for the group photo section, please. Please turn on your webcam, and I will count to 5. Please don't forget, give a warm smile. 1, 2, 3, 4, 5. Thank you so much for all your cooperation. Excellency, honorable guest, honorable speaker, distinguished guests, ladies and gentlemen. To end our program, please allow me to express my gratitude to all honorable speakers for spending your valuable time with us today, and all audience for following our program to the end. Wish you all safe from COVID-19. Thank you.
Thank you so much.
Thank you.
ขอบคุณច្រើនបងអរគុណ
បាទអរគុណជំរាបលាអ្នកនរគ្នាបាទជំរាបពីរកបាទពេញបាទអរគុណហើយបាទ